Hi, my name is Marta Domini. I conducted as a postdoc at Tufts University in collaboration with the WASH cluster in Myanmar a study on cash-based intervention for WASH operation and maintenance in internally displaced person sites in Kachin, Myanmar. So while cash-based intervention are increasingly used in humanitarian aid response and in the WASH sector, the strength of evidence of their effectiveness is low, in particular in protracted crises. So Kachin, a state in the northern part of Myanmar, is theater of protracted crisis due to long-term conflicts. And since 2015, NGOs began implementing a cash-based program for WASH operation and maintenance. So with this study, we wanted to add to the evidence based on cash intervention for WASH in protracted crisis and to give recommendation for future programming. This was a qualitative research. We identified 3 responding agencies implementing cash-based intervention. For 2 of them, we conducted a desk review, and for 1 of them, we were able to collect field data through focus group discussion and key informant interviews at field level and regional and national level. Main results from the field data collection, we visited 10 camps that were peri-urban or urban with established camp and WASH committees. The WASH committees that were mainly composed by women received monthly cash grants, and they can spend these for 3 categories: community hygiene activities, fuel electricity to run the water pump, and to pay the solid waste fee. So while the committees were responsible for the management and spending decision, the amount was determined by the agencies. We didn't find no evidence of grant misuse or gender disparity in decision-making, and the grant was used in line with community needs and priority. The strength of the program were mostly community empowerment, time effectiveness, increased dignity, and support to local markets, while weaknesses were funding insecurity, insufficient amounts, limited training, weak monitoring, and the risk of exclusion of vulnerable groups. When we compared the design and implementation across the 3 agencies, differences were mainly in the criteria for determining the cash grant amount, the spending categories, or in the decision chain, while all the 3 programs had a control mechanism of expenses in place, no specific feedback mechanism, and IDPs were not directly involved in decision-making. So about the context, the characteristic favorable to cash grants were the community cohesion and trust, the proximity to urban area and the presence of established markets and governance structures in camps, while the differences in success or implementation were mainly due to the micro context, like access restriction or availability of services or items, and in the agency's experience. So we recommend to strengthen funding security and amount, committee skills, the inclusion and participation of IDPs in those programs, transparency monitoring, and alignment between the various actors. So while we can say that cash-based for WASH operation and maintenance in Kachin was suitable, we invite you to join us during the poster discussion to talk more about this study. Thanks.